Celiac crisis, unveiling the hidden dangers of gluten sensitivity. Celiac disease is an autoimmune disorder characterized by an abnormal immune response to gluten, a protein found in wheat, barley, and rye. It affects individuals of all ages and can have a significant impact on their health and well-being. In this comprehensive article, we will delve into the intricacies of celiac disease, including its causes, symptoms, diagnosis, and management strategies. Understanding celiac disease. A. Definition: celiac disease is an autoimmune condition in which the immune system reacts to gluten, damaging the lining of the small intestine and impairing nutrient absorption. B. Prevalence: celiac disease is estimated to affect approximately 1% of the global population, although many cases remain undiagnosed. C. Genetic predisposition: celiac disease has a strong genetic component, with certain genes, particularly HLA-DQ2 and HLA-DQ8, playing a crucial role in its development. Causes and triggers of celiac disease. A. Gluten sensitivity: the primary trigger for celiac disease is gluten ingestion. When individuals with celiac disease consume gluten, their immune system mistakenly recognizes it as harmful, initiating an immune response that damages the small intestine. B. Autoimmune response: in individuals with celiac disease, the immune system produces antibodies, specifically anti-tissue transglutaminase (TTG) and anti-endomysial antibodies (EMA), which target the body's own tissues in the presence of gluten. Symptoms and clinical presentation. A. Gastrointestinal symptoms: abdominal pain and bloating, diarrhea or constipation, nausea and vomiting, weight loss, foul smelling or fatty stools. B. Non-gastrointestinal symptoms: fatigue and weakness, anemia, bone and joint pain, dermatitis herpetiformis, itchy skin rash. Neurological symptoms, for example, peripheral neuropathy, migraines, depression or anxiety. Diagnosis of celiac disease. A. Serological tests: anti-tissue transglutaminase (TTG) antibodies, anti-endomysial antibodies (EMA), demidated gliadin peptide (DGP) antibodies. B. Intestinal biopsy: a small tissue sample from the small intestine is obtained via endoscopy to assess the extent of damage to the intestinal lining. C. Genetic testing: genetic testing can identify the presence of HLA-DQ2 and HLA-DQ8 genes, which are associated with celiac disease. However, it alone cannot confirm the diagnosis. Treatment and management of celiac disease. A. Gluten-free diet: the cornerstone of celiac disease management is strict adherence to a gluten-free diet. This involves avoiding all sources of gluten, including wheat, barley, rye, and their derivatives. Careful label reading and dietary education are crucial. B. Nutritional support: individuals with celiac disease may require nutritional supplementation to address deficiencies in vitamins, for example, vitamin D, B vitamins, iron, and minerals, for example, calcium, zinc, caused by malabsorption. C. Monitoring and follow-up: regular checkups and monitoring of nutrient levels, antibody titers, and intestinal healing are essential to ensure the effectiveness of the gluten-free diet and overall well-being. D. Support and education: joining support groups and seeking guidance from healthcare professionals specializing in celiac disease can provide valuable information and emotional support. Potential complications and associated conditions. A. Dermatitis herpetiformis: this skin manifestation of celiac disease often presents as a chronic, itchy rash. B. Malabsorption and nutritional deficiencies: untreated celiac disease can lead to malabsorption of essential nutrients, resulting in deficiencies and associated complications. C. Osteoporosis and bone health: long-term malabsorption of calcium and vitamin D can lead to decreased bone density and an increased risk of fractures. D. Other autoimmune diseases: individuals with celiac disease have an increased risk of developing other autoimmune disorders, such as type 1 diabetes, autoimmune thyroiditis, and rheumatoid arthritis. Potential long-term health risks. A. Increased risk of lymphoma: individuals with celiac disease, particularly those with persistent intestinal damage despite a gluten-free diet, have a slightly higher risk of developing certain types of lymphoma, such as enteropathy-associated T-cell lymphoma, EATL. B. Infertility and pregnancy complications: untreated celiac disease may contribute to fertility issues in both men and women. Additionally, pregnant women with celiac disease who are not following a strict gluten-free diet have an increased risk of complications, such as miscarriage, preterm birth, and low birth weight. C. Neurological disorders. Some individuals with celiac disease may experience neurological symptoms, including migraines, ataxia, loss of muscle control and coordination, peripheral neuropathy, nerve damage in the extremities, and seizures. These symptoms may improve with adherence to a gluten-free diet. D. Dental health issues, dental enamel defects, recurrent mouth ulcers, and an increased risk of dental cavities are observed in individuals with celiac disease due to the effects of malabsorption and nutrient deficiencies. Gluten contamination and cross-contamination. A. Hidden sources of gluten. Gluten can be found in various food products and ingredients, including sauces, soups, salad dressings, and processed foods. It is essential for individuals with celiac disease to carefully read food labels and be aware of potential hidden sources of gluten. B. Cross-contamination risks. Even trace amounts of gluten can trigger a response in individuals with celiac disease. Cross-contamination can occur in shared kitchen utensils, cutting boards, toasters, and through contact with surfaces or cookware that has been in contact with gluten-containing foods. It is crucial to maintain a gluten-free kitchen environment and communicate dietary needs when dining out. Non-celiac gluten sensitivity. A. Distinct condition. Non-celiac gluten sensitivity, NCGS, is a condition characterized by symptoms similar to celiac disease but without the characteristic intestinal damage or autoimmune response. The exact mechanisms and prevalence of NCGS are still being studied. B. Symptoms and management. Individuals with NCGS experience symptoms such as bloating, abdominal pain, and fatigue after consuming gluten-containing foods. The management typically involves avoiding gluten to alleviate symptoms, although the long-term health implications are not as severe as in celiac disease. Ongoing research and advancements. A. Diagnosis improvement. Researchers are exploring alternative diagnostic methods, such as blood tests for additional antibodies and biomarkers, that could enhance the accuracy and efficiency of diagnosing celiac disease. B. Therapeutic approaches. Several clinical trials are investigating novel therapeutic approaches for celiac disease, including enzyme-based therapies to break down gluten, vaccines to induce gluten tolerance, and medications to modulate the immune response. C. Gluten detection tools. Advancements in technology have led to the development of portable gluten detection devices and smartphone applications that can detect the presence of gluten in food, helping individuals make informed choices while dining out or grocery shopping.